Welcome to China in Focus. I'm Tiffany Meyer. NTD has obtained photos from inside the Chinese regime's internal epidemic prevention meeting on January 16th. It's further evidence that the regime concealed the outbreak from the rest of the world. The January 16th meeting occurred in Shijiazhuang, the capital of Hebei province. This image shows the timestamp 14:01:36, January 16, 2020. It was taken at the city's health system safety and novel coronavirus prevention and control meeting. After the meeting, the city set up a municipal health committee and 2 expert groups for medical treatment and disease control. It also designated a hospital for treatment of an unknown disease. One day before the meeting on January 15th, China's National Health Commission issued a special notice to provinces and municipalities on the diagnosis, treatment, and prevention of an unknown pneumonia caused by a novel coronavirus. The notice is labeled as Special Class, the highest classification, meaning it must be processed immediately. It outlines secret training on a novel coronavirus treatment program. It explains that some Wuhan hospitals had been finding cases of an unknown pneumonia since December 2019. The notice says the result of a scientific analysis showed it was a novel coronavirus. The notice goes on to outline detailed requirements for medical staff, including guidance on protective gear and how to reduce transmission risk inside hospitals. The Associated Press also reported that China's National Health Commission held a secret video conference on January 14th. Health officials stressed in the meeting the epidemic situation had become complex and severe, and the virus could spread abroad. On January 16th, the Hebei Province Health Commission forwarded the special case memo to city-level health commissions. The next day, the Shijiazhuang City Health Commission issued an urgent notice on the prevention of infectious diseases. It told health bureaus to focus their work on the prevention of such infectious diseases as influenza and unknown pneumonia. But it wasn't until 3 days later, on January 20th, that the Chinese regime publicly gave instructions on prevention and control for the first time. That night, an expert admitted for the first time there was human-to-human transmission. Now to China's northernmost province, Heilongjiang. According to Chinese state-run media, the outbreak risk level for the entire province will be classified as low, starting from May 7th. A notice from Heilongjiang Province's Command Group for Combating Epidemics said the risk level for one district in Harbin, the province's capital, will be downgraded from medium to low on May 6th. And all aspects of society should begin returning to normal, provided the virus situation can be kept under control. But can it be kept under control? Just 4 days before the notice was released, state-run media reported that certain restaurants in Harbin, like barbecues, had to close again to prevent people from gathering together in large groups. A date for reopening wasn't announced. And on April 30th, just 1 week ago, the same district in Harbin, which had the risk level downgraded, received a donation of about $660,000 worth of medicine, face masks, disinfectants, and other supplies. Local authorities said it's the biggest donation the district received since the outbreak began. They also said the district is in a critical period for epidemic prevention and control. A Harbin resident told us the situation is still serious and people only go out when necessary. And in Daqing, another city in the same province, a May 4th video shows residents in one residential area blocking an ambulance from entering. It was reportedly bringing 1 or more people from another residential area there for quarantine. And residents weren't happy. We interviewed a resident there. He said the prevention methods are still very strict. Medical experts had come to check the city. People are quarantined in hospitals and some bus routes are canceled.
When entering and exiting the residential area, inspections are very strict. They check us one by one. It's really impacted our life. Some long-distance bus routes have stopped, short ones too. We have to register when we go out to shop. It's impossible to take care of daily tasks normally. Every day, life is hard.
Official U.S. trade data from May 6th shows American exports